I feel like with colonoscopies, there's a lot of stigmas about it, and removing barriers so that people will get the test done is important. So I tell them I'm doing it. That makes them, in some situations, it makes them feel more comfortable. Sometimes not. Usually they're more comfortable. Okay, my doctor's going to be there. He's going to be doing the test. People are worried it's going to hurt. Over the years, we have developed changes in our anesthesia protocol. People go to sleep. You sleep through the entire procedure. You're breathing on your own, but you feel nothing. So then they're like, Then people will say, God, I know somebody when they woke up, they were full of air and they're really crampy and they're hurt all day. We've changed that around. So we use, instead of using air from the room to pump into the colon, we put carbon dioxide so that your body absorbs it. You're a lot less crampy afterwards. So we keep evolving. The tube gets smaller. It gets more flexible as time goes on. All of the barriers that people have that are fears, we try to take away so that they can get it done.
This is the Buffalo Community Podcast, all about the greatest small town in the USA, the people in it, and how it all works together. Here are your hosts, Tyler Reiss and Mark Benzer.
Hey everybody, it is the Buffalo Community Podcast, and we've got Dr. Dale Lawrence in here on behalf of Stellis Health, and we're going to talk about a couple of things today, some high-level things with Stellis, and some very important things about your health as well. So, Dr. Lawrence, thanks for coming in.
Yeah, good morning. Thanks for having me.
Yeah, we appreciate it. Well, let's go. The main reason is thanks to Stellis Health.
Nailed it.
Right on.
Oh, boy. Good thing I wasn't part of their group of choosing their name. It would have never got past that. But Stellis Health was a major sponsor of the Street Party of Hope. Tell us a little bit about that.
Right. The Stellis Health has been a part of and a sponsor for the Street Party of Hope even before when it was, what was it before? Part of the foundation.
Pink Street Party.
Pink Street Party.
Yeah. So, I mean, it goes back way to the beginning. And it's a good way for our group to be involved in the community, particularly around health-related conditions, specifically cancer. It started out as breast cancer, and now is kind of all cancers. One of the things that's important to me is colon cancer screening because I do colonoscopies as part of my practice. So it is important that we continue to try to educate people about cancer screening.
Yeah. And a little bit about the Street Party is it's developed a lot in the last 10 years.
It's changed, yeah.
And I think one of the best things for the enjoyment of the evening is moving it from October to September.
Right.
You're banking on way better weather in September.
And I think they've had better luck with that since they've done that. I can remember I sold cotton candy for Rotary one year, and it was really, really cold. And it started to rain, too.
Yeah.
So.
Yeah, it's like cotton candy just fizzles out. But
Yeah. This year we had a little bit of bad luck with, weather started out great, but of course rain comes in. So even when you take measures to try to improve your chances of good weather, of course, never fails that rain comes in. But awesome turnout. It was a great turnout.
Good attendance.
Good entertainment and a lot of feedback from the community of just the how refreshing it was just to be out amongst people.
I think people are
normalcy.
craving that.
Yep, absolutely.
People are craving that interaction with each other in a normal fashion.
Yep. Well, let's shift off of that and tell us a little bit more about you. Obviously, Dr. Dale Lawrence.
Yeah, sure. So I'm not a Minnesota native. I grew up in Illinois. My dad was in advertising. My mom was a teacher, so I didn't have any kind of draw to medicine as far as like family goes. But it was something I kind of thought I always wanted to do, and ended up going to college in Decorah, Iowa, at Luther College, and was there for 4 years. A lot of the things in my life I've really kind of lucked into because I ended up going to Luther, and it had a really great pre-med program, and when I went, it sent the second most students to the University of Iowa for medical school. And so I'm like, wow, I really lucked out. This is going to be this is going to be good.
Yeah.
Going with the herd here.
Yeah, that's right. So I went through and did all that sort of stuff and took my tests and did, I did well enough on the tests. But when I applied to Iowa, I had overlooked something. I was still an Illinois resident, and all of the people that were getting into Iowa were Iowa residents. And so I was competing against a much bigger pool of people. If I had changed my residency and lived in Iowa during college, I would have gone to the University of Iowa. So at my first year out, I didn't get into medical school. So kind of had to regroup and retool my plans. I talked with the advisors and said, is this something that I really should be doing? He said, your numbers are good. You can do this. You should be doing this. So I applied again the next year, cast my net a little bit differently, and got into two places, and I had to make a decision if I was going to go to rural southern Illinois or to Des Moines. By that time, I was dating my now wife, and for our life, it made more sense to go to Des Moines. So I went to Des Moines. I spent 4 years in Des Moines, graduated from Des Moines University, which is an osteopathic medical college. Osteopathic medicine is a little bit different than what we call allopathic medicine, which is the MDs. Osteopathic medicine teaches structural manipulation, so kind of like what chiropractors do, but it's a little different. And they promote, respiration and circulation to try to improve healing. When osteopathic medicine was founded back at the beginning of the 1900s, they didn't have antibiotics, and lots of people, died from things like pneumonia. At that time, the MDs, all they were giving people like arsenic and mercury because that was stuff they thought worked. I mean, really,
Turns out it was killing them.
Killed people, but they didn't know that. The osteopaths, the DOs at that time, were doing manipulation to try to improve respiration and circulation, and less people died. Over the last 100 years, the two types of medicine have really kind of come together. It's not that much different. When you see me or you see Dr. Robel at my office, who's an MD, you're not getting a very different experience anymore, but a lot of it is historical, and some of the training's a little different.
Yeah. Couple thoughts. Anytime I hear Decorah, my family and I have discovered Decorah in the last 2 years, and it is a fantastic town.
It's beautiful, and it's changed a lot in the 25 years since I was there too.
Yeah. So camping, cool breweries, trails,
canoeing on the river, tubing. It's
not what you think of when you think of Iowa.
No, not at all. It's not flat.
Yeah. Northeast Iowa's beautiful.
Bluff country. Luther College is set kind of in a valley. It's absolutely fantastic.
Yeah.
It was a great place to go to school.
My biggest complaint is their football field's blue, which bothers me a little bit. But
bothers me too. I went back and visited, and they had changed the color. I said, "Oh no, this isn't good."
It's hard to watch.
I don't like this.
Yeah, and also just so glad that you weren't a Hawkeye. Like how close you came to being a Hawkeye, and avoided that.
And growing up where I grew up in Northwest Illinois, the Hawkeyes were the enemy.
Yeah.
So it was going to be
trouble.
It was going to be tough to do that. So
awesome.
One question I have, you said the MDs and the osteopathic ones. Is there any, you guys ever given each other any grief, kind of like state troopers and deputies give? Anything like that? Any fun professional banter?
Not really. No, not anymore.
Dang.
In the 70s, there was a lot of, they didn't like each other.
Sure.
But that's we're past all that.
Yeah.
Sure.
How has, you mentioned similar to chiropractic, but, some differences there? Because when I think of manipulation, my head goes right to
what a chiropractor does. It's similar in that some of the techniques are similar. DOs do a lot more soft tissue manipulation.
Okay.
Chiropractors are moving bones on bones. And a lot of the things that we're trained in is more soft tissue to kind of get muscles to release and relax, tight tendons and sort of things to improve. Sure. We do the other things as well, but it's in today's world, some of it is done, some of what we do is also done by physical therapists, even massage therapists, OTs. So it kind of branches the whole.
Sure.
Yeah.
So, Illinois, college in Iowa. Now you and your family are staples in Buffalo.
Well, and after that, I went to Michigan.
Oh, okay.
And I actually graduated from Michigan State University for my residency. So it was another Big Ten, another Big Ten place. And we were there for 3 years. And my wife Amanda hated Michigan.
Oh, okay.
She was from the. Excuse me.
Yep.
She was from the Twin Cities, and I remember she drew a circle around the Twin Cities and said, "Anywhere in here." And so I
threw a dart.
I called a recruiter, and we found Buffalo, and this was my first job, and I think it's going to be my last job. So,
Very cool.
We'll talk a little bit about your job.
Sure.
The importance of cancer screening.
Sure. So I'm trained as a family practice doctor, so I take care of kids and adults and elderly and men and women, and so I think I'm kind of uniquely situated to help people understand the importance of colon cancer screening. When I was in residency, some of my trainers had kind of encouraged me to learn how to do colonoscopies, and I was kind of mildly interested in it. I liked doing things with my hands. I liked doing things out of the office. So I was pursuing that. But what really kind of set the hook is when one of my trainers in in residency, he was having some rectal bleeding, and he was in his 40s, and he had hemorrhoids, and he thought the hemorrhoids were bleeding, so he never got anything done about it. He realized that he had stage 4 colon cancer that had metastasized to his liver, and that was when he couldn't poop anymore. And he realized at that point that the bleeding wasn't just hemorrhoids, and it was coming from a bigger problem. And he was dead within 2 years. At that point, I realized I was in a unique position to try to influence people to get screening tests done. And I feel like with colonoscopies, there's a lot of stigmas about it, and removing barriers so that people will get the test done is important. So I tell them I'm doing it. That makes them, in some situations, it makes them feel more comfortable. Sometimes not. Usually they're more comfortable. Okay, my doctor's going to be there. He's going to be doing the test. People are worried it's going to hurt. Over the years, we have developed changes in our anesthesia protocol. People go to sleep. You sleep through the entire procedure. You're breathing on your own, but you feel nothing. So then they're like, Then people will say, "God, I know somebody when they woke up, they were full of air and they're really crampy and they're hurt all day." We've changed that around. So we use, instead of using air from the room to pump into the colon, we put carbon dioxide so that your body absorbs it. You're a lot less crampy afterwards. So we keep evolving. The tube gets smaller. It gets more flexible as time goes on. All of the barriers that people have that are fears, we try to take away so that they can get it done.
Yeah, it strikes me as one of those things where, and I can't really think of a great example other than a colonoscopy, where the fear might be just in where I guess the issue isn't the issue, or their excuse isn't the excuse.
Oh, right.
You got to get past the first or the second excuse to get down to like that core fear, the heart of it. And I imagine there's probably a certain amount of people where the whole idea of it, I don't care if it's more flexible, I don't care if you're using carbon dioxide, I don't care. It's still a colonoscopy. I know what that is.
And I don't want you doing that.
Don't want you to do it. I gave you these excuses, but really
stop asking me about
it. Can you work with that?
Well, and there are other screening tools, and you can check stool for blood. The thing about checking stool for blood, pardon me, is that most cancers don't bleed. Majority of cancers, of colon cancers, they show up asymptomatically. So while we can look for blood, and I think that's a test we would do every year, it's the gold standard right now is to do colonoscopy. Another test that's available is something called Cologuard. It's that little guy on television.
What's in the box?
That's right. Stool on a stick, and they check for genetic material to see if you're kind of predisposed to colon cancer, or if you're shedding cells from colon cancer. The thing they don't tell you is that if you test positive for that test, then you end up getting a colonoscopy, and then you end up getting a colonoscopy every 5 years because you're a higher risk person.
Oh, okay.
Whereas if you'd gotten the colonoscopy to begin with and it was normal, it would be a 10-year follow-up.
Sure.
So it ends up, they're trying to stay away from it, and they end up in it with
And
more.
does that fall onto like a spectrum then of just like
The follow-up?
the Cologuard.
Yeah.
It's like, you're like 20% higher at risk or 80% higher, or is it just like, no, it's a pass-fail type deal?
It's a pass-fail. And a lot of times they're false positives. So there's really nothing wrong, but we don't necessarily know that. If we do the colonoscopy and there's no polyps, there's no cancer, but maybe there's some cells that are coming off of the lining that are before the cancer shows up. And so we got to keep track of those people so they come back more frequently.
When should people start screening?
They just moved the age. For years, it was starting at age 50. That was kind of everybody's birthday present to themselves at age 50. And they just dropped the age to 45.
Sure.
So,
Coming right up.
yeah, I know. And it's good to do. I'm glad they moved the screening age. We've been finding a lot of precancerous type things and cancer in people in their 40s. So.
Yep. What is the treatment when you talk about some of that very, very early sign of cancer? What's the treatment there?
So a polyp is just a little growth in the lining of the colon, and if we take it out and it's gone, then it can't grow into anything else. The problem becomes when it stops being a little thing and becomes a big thing. So if we do a colonoscopy and take the polyps out before they're a problem, then they're never going to be a problem. So that's the best thing. If the polyp has gotten big or there's cancerous changes in it, sometimes still removing it with a colonoscopy is the treatment, and sometimes they have to have surgery. And we're able to provide those services at Buffalo Hospital. We've got great surgeons who come from North Memorial. I've been working with them for 20 years.
Yeah.
And they do a great job.
Would you consider colon cancer one of our more treatable cancers on the spectrum of cancers?
Yeah, it's certainly 100% preventable. If we find the polyps when they're small, then there's no chance of them getting big. And if so it's just surveillance and kind of staying in front of these things. Fortunately, there's a lot of people in Buffalo who are providing the service. A couple of the surgeons do colonoscopies. There's 3 family doctors that do it, and there's a gastroenterologist. So we've got a whole host of folks who can help you meet the needs.
Yeah.
Yeah. Well, yeah, it's always certainly, we had Dr. Lisko in here, I think 2 years ago now.
Oh, sure, yeah.
And it's always kind of certainly eye-opening. I like to hear this, and like, ooh, that time is coming up, and I'm definitely one of those people. I'm like, stay away from that. Like, I'm
Do
fine.
I really need to do that?
Yeah, yeah. So again, that's something I have to come to terms with of, taking care of my own health as I've got donuts and everything. It is something. Just talk to your doctor, talk to your family, and what's important. And you know what? Every doctor I've talked to, that's just like business as usual. That's like me looking at a contract or something. Like, all right, well, here's what we're looking at.
Sure is. When you do 1,000 of those a year, it's nothing special about anybody.
Yep.
Yeah.
There's other kinds of cancer besides colon cancer.
Absolutely.
As a family doctor, I'm sure that you've referred people on saying, hey, we don't like the look of this test result or this symptom. I think getting that checked out. Maybe touch on that a little bit.
There's other screening tests in things that they're major causes of cancer, things like prostate cancer, things like breast cancer, and getting a yearly mammogram starting at age 40 for women is important. Something that should be touched on is that men get breast cancer too. There's 4 of us in this room. Percentages are probably that wouldn't be end up, but if you get enough men in a room together, somebody's going to end up with.
My father-in-law had breast cancer.
So and it's detected the same way. A mammogram is basically a fancy X-ray, kind of looking for changes in the soft tissue. We're lucky in Wright County in that we have 3D mammography, which is really kind of cutting edge, fancy imaging, and both Stellis Health offers that at both sites in Monticello and Buffalo, and Centricare Hospital in Monticello offers it, as well as Buffalo Hospital. So there's plenty of opportunity for that. Again, in this room with 4 guys in here, we're risk for prostate cancer, and there's an old saying that says if a man lives long enough, he's going to end up with prostate cancer. Everybody's going to get it if you live long enough. I don't know if that's true or not, but it's certainly pretty common. And we're screening for that starting at age 50. Usually there's no symptoms with that.
Sure.
Really?
Sometimes if there's some blood in your urine or your semen, that's certainly alarming. So then you come talk to the doctor and we do evaluations. But that's I'd say the exception.
Yeah.
So would you consider, like, if you have any changes in your body, you should if something's different, this
if there's a
isn't
new
standard,
lump that hasn't,
you should go get it checked
it's not
out.
going away, you should go get it checked out. There's
Yeah.
all kinds of things. And this is something that we deal with all the time, so we're able to kind of help guide folks through that process. If they need to see a specialist or they need to see an oncologist, we have a lot of that stuff, that those folks that come here to us in Buffalo, and we have a great oncology program at the hospital. There's also oncology program in Monticello, and they offer radiation. So there's a lot of things in Wright County that we can help you with.
You know what I hear a lot of is just how, whether it's like we're so lucky here in Buffalo, or we're so lucky here in Wright County to have like blank.
This or that, right?
This or that. We had Sheriff Derringer on, and he mentioned a couple times the training center that we have throughout COVID, with our facilities. I mean, Minnesota in general is just a great place to live and practice medicine. There's
It's
just
a great
so
place
much,
to be a doctor.
so much resources, and it's right here in our backyard. And so it's just cool to hear, from people who know better, that we have these awesome resources for detecting cancer and treating cancer,
Right.
and things of that nature.
Off of cancer,
Yeah, maybe get away from that.
Right. Hobbies. What do you like doing outside of colonoscopies?
Sure. Yeah, so I can tell you about my family. I've been married to Amanda Lawrence. We just celebrated, I think it was 25 years this year in June, being wedded. We have 3 kids. Elizabeth is a senior at Gustavus, majoring in geology. She's going to probably do something with water quality when she graduates next year. My next oldest, Rachel, is a freshman at St. Ben's, and she's studying accounting. And my youngest, Lucas, just got his driver's license on Tuesday. He's a sophomore.
So stay off the sidewalks, folks.
Right. So we like to do a lot of things as a family. We travel. Before COVID, anyway, we did a lot of traveling. We're starting to get back into that now. I like golfing. I like reading. I really am trying to do a better job of work-life balance. There was a time with work that it was really all-consuming.
Yep.
Let us know when you get that.
Yeah, it's like holding back water. You gotta just keep trying.
Yeah.
So, I'm doing better with it. I'm trying to do better with that.
Good.
Take care of myself so that I
Yep.
can take care of others.
Yeah.
Where's your favorite place that you've traveled?
Amanda and I went to Italy 10 years ago, and that was fantastic. It was like 4 little trips, all in one trip. We went
Cool.
to Florence and Rome and Positano, which is on the Amalfi Coast. It was a great trip.
Is that something you plan yourself, or is it kind of a
No,
tour?
at that time we went with we had a travel agent take care
Okay.
of everything for us.
Yeah.
And that was fantastic.
Yeah.
Where's the next bucket list place that you'd like to go?
Ireland.
Ireland?
I'd love to go to Ireland.
Very fun.
You should do that.
I know.
Wise words there, Mark.
Yeah. Thanks.
Yeah, well, that sounds fantastically awesome. Thanks for telling us about cancer screening and the importance of that, and thanks to Stellis Health for sponsoring the Street Party of Hope, and that we can all be here today.
Yeah, we're always happy to do that.
One of the parts we like to invite you guys as audience members to be a part of our show. You can always call our Google Voice number at 612-405-7993. Go ahead, leave a message, and we'll talk about whatever topic, if it's appropriate, or if we're interested enough. Do it. We go through them all, and we just need to fit them in, but we can air your voicemail on the show. But for the Buffalo Community Podcast, I'm Tyler Reiss.
I'm Mark Benzer.
Dale Lawrence.
Thanks for listening to the Buffalo Community Podcast, produced by Edlund Media. You can find us on Facebook and YouTube, as well as anywhere you listen to podcasts.